BBC News.
Linda used to be so tired she'd go back to bed once her daughter had left for nursery. She had fibroids, non-cancerous growths that can form in the womb, causing anemia and terrific pain.
I expected to feel tired as an older mother. I didn't expect to feel totally and utterly washed out. Just taking my daughter to the car in her baby seat left me thinking I've got to go back to bed for a rest.
Fibroids can grow as large as a baby, and more usual methods of treatment involved cutting them away or performing a hysterectomy, both causing infertility.
Approximately 75,000 patients have hysterectomies in the UK, of which about 25,000 of those are for fibroids.
But today Dr. Walker is going to conduct a new procedure which starves the fibroid to death by cutting off its blood supply. It's called embolisation and is a much kinder option for women who still want to have children.
We've been doing this embolisation procedure for many, many decades, all over the body, in the head, in the chest, abdomen, in the brain itself, for example. But what is new is using this procedure specifically for the treatment of fibroids.
The doctor introduces a tiny catheter into an artery which supplies the fibroid and then puts particles into the fluid.
It's like little grains of sand, and it's carried by the blood flow to the blood vessels that supply the fibroid, deprives the fibroid of its nutrition, and it dies and shrinks.
Kay is today's patient and she's conscious and chatting throughout. The procedure can take up to 2 hours and is followed by a couple of nights in hospital with careful pain control. But for Kay, it's well worth it.
This offers me the chance to treat the symptoms, to get something of my life back without having to have major invasive surgery.
What this procedure does is it kills these fibroids completely. They are stone dead after this procedure, and as far as we can tell, with follow-up going back 4 to 5 years in the French series, they don't recur, they don't regrow, they're permanently dead.
Linda is now fully recovered from her op and is enjoying a new, invigorated lease of life.
Literally a week after the operation, felt so much better. It was unbelievable.
So what would you say to women who have fibroids?
Go for it. Go for the embolisation. It's absolutely fantastic.
Given that this new procedure is only available in a handful of hospitals around the country, we're lucky enough to have 3 of them in our region: St Thomas's, the London Clinic, and here at the Royal Surrey. In Guildford, this is Liz Wickham for London Today.